operation update here at the hospital going into the holiday weekend. As of this morning, we had 50 positive patients here at Memorial. 6 of those are on ventilator life support. In total, we have 222 patients in the hospital, which I think is about as high as we've ever been. It's really a lot like battlefield medicine at this point. We're in what they call contingency capacity conditions, kind of in the disaster pandemic parlance. And what that means is we're having to use spaces we wouldn't normally use and staff that are still qualified to care for the patients, but maybe that's not their normal job category. And so we're kind of flexing to meet this increased demand. We continue to have a high number of employees out, which does exacerbate our staffing challenges. Looking at this morning's Yakima Health District situation report that Nathan Johnson puts out, there's really some concerning information on that. So there's 412 new cases in the last 24 hours. We continue to see increased activity in children. Just yesterday, 120 of those new cases were people under the age of 19. Our case rate in the county is currently 1,016 per 100,000 people. That's an incredibly high rate. That means that there's a really big reservoir of people out there spreading this around. And so it's really kind of a high-risk situation. The other number that really jumped out at me is in the last 24 hours, we've had 7 deaths related to COVID here in Yakima County. Probably not going out too much on the limb to say that's probably a new high for us again. So we have started to see more people dying from this. I think I reported last week that the death rate was holding steady, and I don't think I can say that anymore. Some of the internal measures we've taken here at Memorial, we do continue to be in emergency operations. We have 7-day-a-week incident command. The focus of this is to address any issues from the past 24 hours and look ahead to the ensuing 24 hours to try and anticipate what needs there may be they staffing holds or other issues. We've redeployed a lot of staff, mainly from the ambulatory side. In a lot of cases, having to retrain them on our electronic health record into new jobs so they can fill holes in critical care needs here in the hospital. We've also taken an inventory of basically every employee in the organization, asking if they have previous clinical experience, because we do have some people that are now in more of a clerical role that at some point in the past may have been an NAC or a phlebotomist or something. And we're taking inventory so we can redeploy them if needed into the clinical spaces. I do want to thank the community. I asked last week for people to step forward if they did have nursing and other licenses. We did have a number of people answer that call, and that has helped. So we're currently finding roles for them and training them into those roles. So again, thank you to those who stepped forward. A couple of quick operational notices. We did move our outpatient infusion care center from the hospital out to North Star Lodge. We already had an existing infusion care operation out there related to our cancer care. We've now combined those services. That's allowed us to free up the space in the hospital that's now seeing acute care patients that are being admitted from the ER. So it's part of how we got to that 222 patients, is we have some additional space in the hospital we're using now. The other one is we do have at our Pacific Crest Clinic out on 72nd Avenue across from Rose Hours, we're now doing walk-in care 12 hours a day from 7 a.m. to 7 p.m. That's Monday through Saturday. So the only day they're not operating is Sunday, and they will be open on Labor Day, on the holiday. So we want to make sure everyone's aware of that. We're in close contact with our community partners here in Yakima County. We're trying to coordinate on some activities and just making sure that we have awareness of what other people are facing. We also have regional calls outside the county with places like Confluence Health up in Wenatchee, Kittitas up in Ellensburg, Kootenai and Coeur d'Alene, and several others as well. The messaging has been pretty consistent from these phone calls and these meetings. We're all facing significant staffing challenge and significant volumes challenges in addition to the surging COVID cases. I do want to say a little bit about ivermectin. There's a lot in the media about this. It's interesting that we've had various kind of experimental treatments pop up over the course of the pandemic. I've not seen one kind of grow the legs that we've seen with the ivermectin. There's multiple warnings out now, both by that do include the CDC and the Washington Department of Health, These are not approved for human use. There's been no clinical studies that have shown their effectiveness. And as a result of that, there's actually not even any dosing guidelines. So if anybody is out there prescribing it, they're really just guessing in terms of how much to prescribe and how frequently to prescribe it. And again, there's no clinical data to support its use. Many state licensing boards have come out and said that they will discipline doctors who give it. And so licensing boards are also kind of stepping on that issue as well in terms of issuing warnings. And last week I was asked if we'd seen any patients because of ivermectin, and I can report that we have actually seen that and admitted at least one patient as a consequence of taking ivermectin. Again, the danger for us here in this society and why this is such a big issue for us here in Yakima is this is a commonly used anti-parasitic medication, so treating parasites. Here in Yakima, it's used in the veterinary medicine field. And since we have a lot of veterinary medicine here, it is available to a lot of people here in Yakima. And we just need to make sure people don't try and take these veterinary medicines for their own use. One of the main reasons we want to do this press conference today is because it is the start of the Labor Day weekend. We do know historically that holiday weekends lead to surges. Right now we're already in a surge going into the weekend, so it's a particularly dangerous time, especially with the case rates the way they are right now. Again, 412 new cases yesterday alone, and over 1,000 cases per 100,000 rate of infection in the community. That's what we're facing going into the weekend, when you're going to have sporting events, you're going to have concerts, family gatherings, barbecues. That's all great. If you're going to do that, please mask up if you're going to be in public spaces. Try and hold them outdoors where the risk is way smaller than if you're indoors. Fortunately, I think the weather forecast is pretty favorable for the weekend, so try and hold the celebrations outside if you're going to have them. But it's an extremely dangerous time for our community right now. The hospital does not have any additional capacity, so we really cannot exacerbate this current surge. This does apply to both the vaccinated and the unvaccinated patients. Although the majority of our patients that we see are unvaccinated, and those do tend to be the younger and the sicker ones, we do have some breakthrough cases, and we are seeing some vaccinated people end up in the hospital. So I think sometimes there's a false sense of security once you're vaccinated, and although you're greatly protected compared to not being vaccinated, you're not immune. It's not 100% immunity, so we do need you to be careful as well. So with that, I'll take any questions that anybody might have. I'll start with Emily, just go right to left here.
So there was a really bad crash that happened this morning in Mapton, and there were some patients that I believe were sent here. Are you able to find room for patients like that? And or were you did you have to send them away, or what's the state of the ER right now?
I'm not aware of that case at this point. If they're a lot of our really sick trauma patients do go to Harborview. That's the regional trauma center. And they do have a policy for unstable trauma patients to just accept them and basically figure it out when they get there. But no, I'm not familiar with what happened with those cases.
Of the 7 deaths from COVID, how many of those people were vaccinated?
I don't have that information. That was reported in this morning's situation update report from the Yakima Health District, and they don't break it down with that information. So you'd have to check with them if they have that information.
Of the breakthrough cases, are there any patterns among the people who are vaccinated but still getting sick?
Yeah, I think what we're seeing mainly is these are your older patients and a lot of the ones with comorbidities. I'm looking at Dr. Fernandez behind you here, who's primarily responsible for taking care of a lot of those cases. And that's kind of what I understand, right, Bismarck? Yeah, Dr. Fernandez kind of confirms that the ones that we are seeing with the breakthrough, they tend to be the older patients with other health problems, and also the ones who got vaccinated way back in kind of January, February. Again, as a general rule, there's no absolutes here, and we certainly see unique situations all the time, but that's the majority of the cases.
Yeah. Have you had to do a lot of transfers to other hospitals because of capacity issues, or are we kind of borderline right now?
Yeah, so that's probably the biggest difference between last summer and this summer. Is when we went through this last summer, we were kind of running our own race on this. And Yakima County was one of the worst places in the country for COVID. But one of the benefits we had is, especially over on the west side, they didn't see a whole lot of it. We were in constant contact with Virginia Mason, and we would have 40 people admitted to our hospital, and they'd have half a dozen. And so we had a lot of ability to transfer last year. It's a completely different situation now. Every hospital, in the country for that matter, but certainly in the region, is facing the same thing we are. And this is a reason we are in constant contact with other hospitals in our region, is except in those cases like the unstable trauma patients or some other unique situations, nobody's got room. And so patients are sometimes having to sit a day or two waiting for a bed to open up so they can be transferred over. And these are patients that require services that you only find at a major university or tertiary care center. So care we can't provide here in Yakima.
So out of the patients that you're seeing right now, how many of them, how many are waiting to be transferred or trying or in the process of being transferred?
Yeah, that fluctuates, so I don't know what the current situation is right now. I worked in the ER yesterday, and I can tell you that one of my patients was going to be holding in the ER until a bed opened up at a tertiary care center. We didn't have any timeline on that. Mm-hmm. And so it is happening. Though in general, we try not to admit those patients to the hospital. Mm-hmm. We tend to hold those in the ER if we know they have to be transferred. So those won't show up on as our 222 patients in the hospital.
And then I have a follow-up question. Okay. What's the situation with the ICU and how many patients?
It's full. Yeah, and that's just about every hospital in the region. We are all full, and that's the biggest problem.
And are they full with all COVID positives or different folks? Or?
Yeah, so that's the other thing that's a lot different this time around is, as bad as it got with COVID last year, overall our hospital and emergency department census has actually dropped. In some cases to historic lows, something we didn't really see coming when it happened. But the good part of that is it did free us up to be able to really manage the COVID patients. This time around, we are just seeing just huge numbers of very sick patients for non-COVID related things, and now you've thrown the surge on top of that. And that's what's created such a dangerous situation, because we're already kind of fully engaged taking care of really sick non-COVID patients. Now we're having to flex to this surging demand. And with the pandemic, those numbers can jump really quickly on you, as we've seen.
Is there certain conditions that you're just seeing a lot more of? I know with kids, there's been a lot of talk about the RSV surge. I don't know if we're seeing that here, or is there certain diseases or things that are really seeing an uptick?
So that's a great question. I'd say on the adult side, it's kind of everything. Mm-hmm. I think a lot of us are trying to explain what's going on. We don't know if it's just kind of a backlog of the patients who didn't seek care during COVID or what it is, but it's really all across the board. Mm-hmm. With the kids, I don't know that we've necessarily seen a big surge in the hospital from it. I know that it's been a big problem on the East Coast and now in the Midwest. I was just talking with a nurse in the Midwest this morning, and she was relaying that they were seeing large volumes of RSV kids being admitted. We have seen a handful of positive cases, and so I suspect that we're on the verge of seeing more of them. But the longer that stays away, the better, because that'll be a big problem if we start to see a lot of RSV kids.
Ryan, let's take one more question from you, and then we'll go to Dr. Fernandez.
Now, with this ivermectin thing, seeing hospitalizations, what are some of the symptoms, side effects that people are experiencing from this?
Yes, I'm not going to speak to any individual cases just for patient privacy purposes, but in general, the problems you can have with ivermectin, they include just a lot of GI upset. So on the mild side, you might just get nausea, vomiting, stuff like that. But on the more severe side, it interferes with the metabolism of other drugs. And so if you're on blood thinners, it can really thin your blood out and cause bleeding. It can cause your blood pressure to drop really low. Cause liver failure. There's kind of a whole host of things, and for the 2 or 3 things that we use it for, we have very established dosing guidelines, and it's generally well tolerated if you're using it for the proper indication. But the problem again is there's no dosing guidelines for this, so people are just kind of prescribing it and it's causing problems in some cases.